Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
In today's Neighborhood Health Watch, we're taking a look at a condition that many people might ignore for years. Truth is, you do not need to live with these symptoms because there is help. Dr. Boyd Clary, OBGYN, urogynecologist at Henrico's Doctors Hospital, joining us here to talk about urinary incontinence. Doctor, thanks for being here, first of all. Explain a little bit about urinary incontinence, what it is, and who it affects.
So, urinary incontinence is the uncontrolled loss of urine that affects your quality of life. So when you're not planning to go to the bathroom and suddenly you have a small amount of leakage. There are two predominant types: stress incontinence, that is leakage when you cough, laugh, or sneeze, and urge, when you have a strong urge and just cannot make it to the bathroom in time.
Men and women, and then of a certain age, who's
Sure. Great questions. And so it can affect both, but it is more common in women. Stress incontinence tends to affect women who are younger. So it's the most common form of incontinence in women under the age of 50, affecting as many as 40 to 50% of women by the age of 50. And in fact, 1 in 4 female college athletes leaks while she does her sport, which is, a lot of women find both scary and reassuring because they're not alone.
Sure. Are people affected by this? Do they come forward? Do they realize what's going on? Or are they a little nervous to come forward?
So I think they do know that it's happening. Everybody knows it's happening.
Sure.
But this generation of women, our baby boomers and the younger women, we're much more active than we were before. And so we're much more vocal about getting treatment and getting help. And you've seen that on TV. Mm-hmm. We now see ads for poise pads or vaginal support devices that help with incontinence. And as a result, there are more and more treatment options, not necessarily surgery, but surgery is one option. Most women, symptoms can be improved.
Before we get to talk a little bit more about those treatments, what are the steps and what, to come forward and identify this? And when do you know, okay, it is urinary incontinence, it is something that I should consult a physician about?
So when to get help is when it starts to affect your quality of life. It prevents you from doing things you normally would do. If you won't go play with your kids on a trampoline because you're afraid you're going to leak, and that's something you want to do, it's time to consider it. Other people wait until it affects every aspect of their life. They cannot move without leakage. So when it bothers you, when it affects your quality of life, it's time to fix it. And as I said earlier, this generation, as we get more informed, we tolerate it less. And the good news is there are many, many things that can be done to help correct it or make it much improved.
All right, good information. Doctor, thanks so much for joining us. We appreciate it.
Thank you.